Alright guys, I'm back again. I promise this is not a motivational video. I only have like 30 minutes on my lunch break, but I know Professor Dayano was mentioning you should practice drawing. I was working on how to draw the combination of two things, how to draw the trace of a drop of blood through the heart and how to draw the electrical conductivity. Actually three things, how to draw the circle of Willis, but I guess I'm gonna split them all up into different videos and I'll upload them as I get breaks at work. I'm gonna start with the trace of a drop of blood if anyone's interested on seeing which valves and which chambers it passes through. I'm just gonna do this quickly. So if you want to learn how to draw this is a perfect opportunity. You definitely want to pause now, grab a pencil and a piece of paper. I say pencil because you're going to need to erase. I kind of just sketch it out first and then I erase what needs to be connected, and you'll see. Alright, so we start with a heart. A very cliche-like heart. And right away, if you see this heart, you'll notice that the right side of the heart is offset a little bit from the left side, as the left side of the heart is much larger. The chambers are much larger. Either way, so we start with a heart, and then we're going to make a cross. Again, notice that I've left more space for the ventricles because the ventricles are bigger than the atriums, right? So far so good? Good. So now we're going to start by drawing some of the semilunar valves. Again, I'm speaking quickly because I have a very limited amount of time, but you can pause and go through this 100 times until you get the drawing. Alright, so we're going to start with the aortic semilunar valve. So we're just going to do a little circle thing like this. And then we're going to draw the arch of aorta. So we're going to go very wide. And this is where your pencil, drop my eraser. This is where your pencil is going to help you out here, because you're going to erase whatever is inside of your aorta. Okay, so with me so far, this is what it should look like so far. Good. All right, so I like to do that just to indicate that it's a valve and it opens and closes, whatever. Alright, next we're going to draw the pulmonary semilunar valve. So we're going to do another little circle thing like this, with another little valve thing on the inside. This time we're going to go straight up. Right, again, back to our eraser. We're going to erase what's inside of the pulmonary trunk. That's good so far. So far we got the chambers, 4 chambers, and we have both the aortic and the pulmonary semilunar valves. As far as the cuspid valves go, bicuspid, tricuspid, I just like to open a door here, just so I know that something is going from the atrium to the ventricle. You don't really have to do anything fancy there, right? So a little door lets me know that the door opens and closes, right? Nothing fancy. Let's see. So we have our cuspid valves, we have our semilunar valves, we have our atriums, we have our ventricles, we have our trunks, aortic and pulmonary. So really we're just missing a couple of branches. So actually we need to open a door in the right atrium for the inferior superior vena cava. So you can go ahead and use your eraser there. Right? And next we're going to open 2 doors in the left atrium for two of the pulmonary veins, the left pulmonary veins, but there are actually a total of 4 pulmonary veins, which I'm sure you already know this, but the other 2 come off posteriorly behind the left atrium. In this one-dimensional drawing, I can't do that. So just assume that I've put here 2 pulmonary veins, but there are 2 more. Now, let's move on. All right, so what's missing? Of course, today we talked about, I don't know if you can see this in the video, I'm gonna move this a little bit back. Let's see if I can make that happen. I think that'll work. Okay, as far as the aortic arch, today we talked about some of the branches there. So we're gonna open up a door for the brachiocephalic. There's our brachiocephalic. Then I'm going to open up one more door, let's say over here, for the right common carotid. And I hope you can see this in the video. And one more door, last door, for the right subclavian. All right, and then of course earlier today he mentioned that the coronary arteries branch right off of the ascending aorta, so they would be right here. All right, so there would, if I wanted to make some branches there, they would come right off of there. But I'm going to leave that out. I'm going to assume you guys already know that. Okay, so now let's talk about the trace of a drop of blood, right? Where does it pass through? I'm going to do red so you can see it, and so you can see the color contrast or difference. And right, so blood comes from the superior vena cava and inferior vena cava, and it first enters the heart in the right atrium. And so in the right atrium, it passes through the tricuspid valve, and from the tricuspid valve, it enters the right ventricle. From right ventricle, the ventricles, of course, will contract and shoot the blood up through the pulmonary semilunar valve. From the pulmonary semilunar valve, we're now inside of the pulmonary trunk. And the pulmonary trunk will bifurcate into right and left pulmonary arteries. Remember, artery means to move away from the heart. So in this case, those pulmonary arteries are on their way to the lungs. I'll put here lungs in blue. So I don't think you can see that very clear. It's almost out of ink here. But either way, so the pulmonary arteries are on their way to the lungs to reoxygenate. All right, so once they've been reoxygenated, they're going to re-enter the heart through the pulmonary veins. Remember that these two are coming from the left lung, but there are two more coming from the right lung. And now we've entered into the left ventricle. From the left ventricle, the door to the bicuspid or mitral valve will open, and the blood will come down into the left ventricle. From the left ventricle, again, we have a big QRS, we have a big contraction, and the blood will shoot up through the aortic semilunar valve into the aortic trunk, right, or what we call the ascending aorta. And then we go through the arch of aorta and down into the descending aorta into the body, right? So that's the trace of a drop of blood through the heart. If you have any questions about where the blood is leading to in any one of the blood vessels, we'll eventually get to a different video on looking at following the blood up into the brain. But for now, we'll stop here on this video, and let's see if I can squeeze another video in for the electrical conductivity. Thanks, bye, see you tomorrow.